Vanakkam, Namaste and welcome to Dr. Shah's clinic on yet another video on erectile dysfunction. We are going to answer the question, how does erectile dysfunction affect relationships? Now, you must understand that erectile dysfunction is now a public health problem and it is estimated to affect 322 million men all around the globe by the year 2025. Not just that, as early as, the large study called the Massachusetts Male Aging Study, and what they had found there was, as early as between 1997 to 2000, about 150 million men were, affected with erectile dysfunction. Not much was actually known about this particular condition in the early 80s or in the early 70s. So, it's a fairly new condition, but what we do now know is that erectile dysfunction is definitely a global public health problem, and there's an increasing awareness on the subject with both the healthcare provider as well as the general public, which is a good thing because erection is a marker of a male's general overall health. So, men who have erectile dysfunction usually have some underlying abnormal vascular problem, and it could be biobehavioral, it could be, hemodynamic, it could be vascular. We don't know exactly what it is, but we know there's something fundamentally wrong with his overall health. And what we are also seeing today is there's an excellent association clinically, between erectile dysfunction, diabetes, hypertension, cholesterol, as well as metabolic syndrome and unhealthy lifestyle habits. There's also a link between erectile dysfunction and coronary artery disease, and large-scale studies have actually validated it. So if a man is diagnosed with erectile dysfunction, there's a very, very high risk that that particular individual will have future coronary artery disease, heart attacks and other myocardial events. So that's something that you have to bear in mind. And the other important thing to discuss here is that a man is said to have erectile dysfunction if he is unable to maintain an erection or able to achieve an erection of adequate rigidity for adequate sexual intercourse, penetrative sexual intercourse with his partner. And this particular diagnosis is given only if the man faces this problem in more than 50% of his attempts. So that's something you must definitely bear in mind. How does erectile dysfunction affect relationships? We're going to answer that question now. Now, with respect to women, there was a beautiful study called the Females Study. So the study was abbreviated Females. The study basically, is expanded as the female experience of men's attitude towards life events and sexuality. So what the study basically looked at was how erectile dysfunction in the males affected females from a psychological perspective and how it, affected their relationship with respect to the men who had it. So in this particular study, they looked at 293 women, and when they asked them certain questions, 86% of women felt that erectile dysfunction is a permanent problem. And, a large proportion of women in the study also reported decreased interest, decreased desire, and decreased ability to reach orgasm when they had sexual intercourse with their partners who had ED. When the partners of these women were actually treated with PDE5 inhibitors, which are basically medications to control the ED, they reported improvement in sexual desire, interest, and orgasm as frequency of orgasm. So what we know for sure, and this is what we see even routinely clinically, even in our clinic, the female partners are largely distressed when the male partner has erectile dysfunction. Most female partners may think that these problems are permanent. Very small proportion of them, kind of actively encourage the male patient to take a treatment. So there's a high risk of, the relationship actually breaking up. And we've seen a lot of patients who are recently married, it might have been 2 months or 3 months, sexual intercourse would have not happened. The male partner might have lost his erection only because of performance anxiety, and the female would have, given a divorce. The female partner would have, would have taken a decision on ending the relationship abruptly. So this is not seen in all parents, this is not seen in all women, but a small proportion of women tend to take such decisions because they think that erectile dysfunction is a permanent problem and it's usually incurable. Some more women think that patients have to be on medications lifelong. So there's a lot of misconfirmation, there's a lot of misinformation and misconceptions about the overall topic of ED itself. So this is something you must bear in mind. Not just that, females also, women of partners, who have erectile dysfunction also tend to feel hopeless. They suspect infidelity in the male partner. They suspect they have a disturbed body image. They themselves become clinically depressed. They are anxious and they report lower desire, lower orgasm, lower ability to achieve orgasm, lower sexual arousal in general. So erectile dysfunction actually, kind of wreaks havoc on your better half. Remember that. So if you have ED, please take a treatment and set it right at any cost. Now, with respect to men, basically what happens is when a male is diagnosed with ED, first, men feel less men when they're diagnosed with ED. It affects their overall self-esteem, their overall confidence, because erection is a marker of a man's virility and strength, and it's been associated with a lot of things, from a socio-cultural perspective. So, that's why, it's a very big thing for men. So, men also tend to, go into clinical depression. Performance anxiety sets in. So every time, if a man has erectile dysfunction once, every time he tries to initiate, again with his partner, he's going to have the same anxiety, and the anxiety and the worry itself is going to kill the erection. So a lot of effects are also seen with respect to men. So what's important to understand here is that with respect to women as well as with respect to men, in general relationships, can be severely strained and disrupted because of erectile dysfunction. And what's very wise here is to take the right treatment, get tested and get treated appropriately for ED. I'll be making many more videos, on erectile dysfunction testing, erectile dysfunction treatment, including some natural remedies that you can try at home right away if you're diagnosed with ED. I hope you found this video informative. Please share this video with all your friends and loved ones. Like, comment and subscribe. This is Dr. Shah. Vanakkam.